Hi, everyone. Welcome to the Washington Post's special report on the coronavirus, COVID-19. I'm Libby Casey, broadcasting live from DC. Thank you so much for joining us. We'll be bringing in some of our reporter guests in just a moment, but first, here's the top news right now. President Trump has called for Americans to continue the practice of social distancing through April. Meanwhile, the governors of Maryland and Virginia have issued stay-at-home orders for their residents. The Virginia one extends all the way to June 10th. And Anthony Fauci, the nation's top infectious disease expert, has warned that the United States could record up to 200,000 coronavirus deaths. We're going to talk all about that with my guests in just a moment. Also during this hour, we'll get the latest from the presidential campaign, because even as this is consuming everyone's attention, there is still a presidential race going on. And Joe Biden just did a TV interview. So we're going to check in with Dave Weigel later on, who's continuing to follow developments in the races around the country. I see our White House reporter Ashley Parker is joining us now. Ashley, thank you so much. We've also got Aaron Blake, senior political reporter who writes for The Fix. He'll be joining us too in just a moment. Ashley, we saw the president make a notable shift yesterday when he really finally joined the experts in saying that this social distancing that health experts are saying we all need to be doing will have to take place through April. Earlier, the president had said he thinks it would be beautiful if that could end by Easter. That's in less than 2 weeks' time. And all the experts said that was really unrealistic. Aaron, I just want to say hi to you and welcome you to the conversation. Hey, so Ashley, what do we know about how the president changed his mind on this?
Sure. So a couple
things.
I
think you're muted, so go ahead and unmute yourself on this.
It doesn't say I'm muted.
I can't hear you yet. This is the new reality of broadcast. We're all of us working from home and figuring this all out, which really makes us appreciate all of our engineers, all of our producers, everyone who works behind the scenes to make these things move flawlessly. Okay, Ashley, I guess people can hear you, so go ahead. I'm the only one. I'm the weak link here. So Ashley, go ahead. You're in good shape. Tell us about what we know about the president's change of heart here.
Okay, so the first thing to understand, and this is a little bit of backstory, but I think it's relevant, is that there has kind of long been a push and pull that the president was experiencing from the economic people in his White House, people like Steve Mnuchin, the Treasury Secretary, Larry Kudlow, and just the outside voices the president was hearing from Wall Street and the Chamber of Commerce, and the scientists and the experts and the public health officials. And that is a real push and pull. But one thing that is not fully understood is that throughout this process, even as he has in moments grown frustrated with them, he has really been listening to Dr. Birx and Dr. Fauci. He sort of does respect them. And that's not to say there's not moments when, for instance, Dr. Fauci gently corrects him at the podium or goes a little too far in his own television interviews where the president gets frustrated, but he listens to the advice of these experts. So the question you asked me is something we're reporting out right now in real time. And what I know so far is that on Saturday, it was described to me that things were quite fluid. It was really unclear where this was headed. But by Sunday, the task force meeting was actually fairly short because it was described as everyone was trending in that direction, that these social distancing guidelines needed to be extended for longer. And the president, on Saturday was briefed by a number of people, but the main briefers were Vice President Pence, Dr. Birx, and Dr. Fauci, and they presented him with some very grim models. And some people have said that the medical experts are giving the president the worst case scenarios, but they caveat that with that's their job, is to make sure the president knows what could happen if no steps are taken. So he sees these grim numbers and he sort of understands that, wow, the death toll could actually be really high. He understands it. He's hearing from campaign officials, and he understands it from a political point of view as well, that as he sort of said in the Rose Garden, and you saw this, declaring victory and then having a spike in deaths is not actually a victory. I mean, it is bad because there's a spike in deaths. It's also bad politically, and in terms of a narrative you're trying to get under control. So there's that factor as well. And again, this is something the president said aloud, but in talking to aides and advisors, it's true. This is someone who watches nonstop cable news, is very much a visual learner. And he was struck, as he said in the Rose Garden and on Fox and Friends this morning, by those images coming out of Elmhurst, Queens, the shadow of where he grew up. He talked about the body bags and the freezer trucks to take away the dead. He's seen these images in papers as well. And that also really sort of helped get him to this place. By the time they talked Sunday, they were ready to do what they did.
Erin, let's bring you in on this question of how the White House is measuring its efforts. Now, we know that President Trump was tweeting about TV ratings and things like that, which seem really besides the point of what's going on here. But you also make a really good point in one of your pieces that you filed recently about sort of moving the goalposts and setting goalposts for what is a successful coronavirus response.
Yeah, so at the very beginning of this process, of course, the president spent weeks basically downplaying this, talking about how it might miraculously disappear all of a sudden. He talked about the idea that once the weather warmed in April, maybe it would effectively kill off the virus. Very early in the process, he repeatedly pointed to the low numbers of cases and the low numbers of deaths that we had in the United States, especially as compared to the rest of the world. And what we've seen as the disease has spread is that we've basically been on a very similar trajectory to other countries that are having very difficult problems with this. So it was a little bit more delayed than we've seen in countries like Italy and China, of course, and Spain. But this has been on that trajectory for a while. And so I think beginning 2 weeks ago today, where the president seemed to adjust his tone for the first time, then he started talking about reopening the economy. And then I think we saw another little bit of a pivot last night where he obviously backed off the reopening of the economy. He started talking about higher numbers of people dying than he ever has before. And I thought it was really interesting that he actually put a number to this and talked about what it would be for the government to have a strong response here, to have done a good job. And he basically said that number is between 100,000 and 200,000. He said he wants it to be below 100,000, but that was kind of the lower bound of what he suggested would constitute a good response. This is really interesting because these are the kinds of numbers that we were talking about 2 weeks ago when that Imperial College London study first came out. That was the number, the higher end, the worst case scenario is what got all the publicity out of that, because it said it could be 2.2 million deaths in the US. There were actually other numbers in that survey that showed what kind of a moderate mitigation strategy would be about 1.1 million. And then the most severe, most aggressive response had a number, at least in Britain, that was significantly lower than those. So what we're talking about right now, what the president is talking about, is basically akin to what that study suggested the best case scenario would be, with the most stringent efforts involved. The question is how exactly the country is going to actually institute them. If they are going to continue to be extremely strict, of course, we see states like Florida not going quite as far as other places. But he has now set that benchmark. He has kind of pre-spun this as being a success if we have 100,000 to 200,000 deaths. And it's merely
sorry, I just want to slow you down, Erin. 100,000 to 200,000 deaths. And so when President Trump, when he says, it could be 2 million deaths or something, it's reframing it so that 100,000 deaths would essentially be a success. But we're hearing that as a warning from Dr. Fauci, and he's trying to raise the alarm, as he has been for a long time now, Ashley, of just what that might look like and feel like. And this idea we've all been hearing about of flatten the curve, how essential it is to make sure that there isn't a mass rush to get hospital care at a time when medical centers aren't prepared. So what are the health experts around President Trump telling him in terms of successfully combating this versus, having it reach even more of a heightened crisis?
Well, they've given him those worst case scenario numbers, but I think what you mentioned, that word reframing, jumped out at me because that's something we've heard from some allies of the president, was he was sort of in search of a reframe on this. And those numbers, Dr. Fauci has been sharing the 100,000 to 200,000. Dr. Burke shared it on the Today Show this morning. And Savannah Guthrie, who was interviewing her, did exactly what you just did, Libby, and said, well, let me stop you. You're saying that the best case scenario means maybe 100,000 to 200,000 Americans die. And that's the best case scenario. So there's not that much difference between the public and the private, right? They're sharing those numbers publicly. They've shared them with the president. The president has repeated them publicly. And you even had Dr. Burke saying that was very much a best case scenario. And she doesn't know if all of Americans are taking the social distancing measures seriously enough to get to that. I mean, it's hard to call 200,000 Americans dead a goal, but to get to that goal. But what Trump is doing is it's exactly that. It's a reframing. And you heard him talk about it this way. And basically, if that is kind of the best case scenario, anything below that is again, victory is not the right word, because no dead Americans are a victory, but it is sort of a narrative victory for this president, to be able to say, we thought the worst case scenario was 100,000 or 200,000. I wanted it to be less, and we got it to be less. And he echoed that language when he said, we don't want to declare victory, because he's cast himself as a wartime president. He's cast himself in a battle against an invisible enemy. We don't want to declare victory and then have the deaths spike and peak, because that would not be a victory. And he's correct in that. One final point is, the president also came out and he talked about, he thinks the peak of the deaths is going to be in about 2 weeks. There's one model that has the peak deaths when you're trying to flatten the curve, but the high point being about April 15th. And that is something that we understand Dr. Birx was the one who told him that her initial estimates of when the death would peak got moved back as she's looked at new models. And that seems like something he's also taken quite seriously.
So I have a question for you, Ashley, that came in from one of our readers. Vupa writes from Alexandria, Louisiana, and asks, why are we not fighting COVID-19 on a war level? Now, President Trump has framed himself as a wartime president. It's in the eye of the beholder what a wartime effort will be like. We are seeing these Navy medical ships now mobilized off the Los Angeles coast, off New York's coast, to try to help on a medical level. But what are the conversations within the White House, Ashley, of how to really treat this as the battle that President Trump sees it, sort of wants to frame it as?
Well, again, I think it does depend on how you define wartime level. Some people, some public health officials might say a wartime level means, back in previous world wars, every American doing their part. And in this case, it's not the women going to work in the factories because the men are all fighting abroad, but it's every American staying in their home and not leaving, not going to see a friend, however tempting it may be, not going to a park and sitting with a bunch of other people for a picnic. That's doing your part. And so we are doing that through the end of April. I think some medical professionals would like to see it further. I think the big question, or one big area, is the Defense Production Act. And the president was incredibly reticent to implement that. And there was a week where, the Washington Post was in briefings every day. And those of us who weren't there, we were all watching the briefings. And in listening to every single word the president said, it was unclear what exactly he meant and what he was doing and when he was going to use it. And there was a lot of reticence because conservatives in his administration sort of viewed using this act to force companies basically to make ventilators and masks and PPE supplies as sort of big government, and would expose him to charges of socialism. And exactly how he wants to paint his Democratic opponent in the fall. Now you saw him finally do that with General Motors because they kind of hit an impasse. But that was one of the areas I think you could fairly say was not maybe the full wartime effort some people like our friend in Alexandria would have wanted to see.
Erin, there's a question of the president being able to work with governors. And we have heard some governors, try to work with him. We've even, we see highs and lows with Governor Cuomo of New York and the president. Sometimes they have praise for each other, sometimes criticism. But this relationship is very significant. And we are seeing the sort of spats crop up in the White House, it seems, when President Trump feels that governors aren't giving him due respect or something. Can you take us through the importance of the federal and state relationship and, how they're working this out?
Right. So basically, states are in the position where they need medical equipment, they need masks, they need ventilators. There is a certain national stockpile of ventilators that has been tapped, especially sending a few thousand to New York. The federal government can, of course, marshal many more resources. It can do things like the Defense Production Act. So while it may not necessarily be in charge of the effort in a lot of these states, it can provide these states with the tools that they need to combat the coronavirus. You're right, the relationship with some of these governors has been very different. The president last week was talking about how he was upset that the governors of Washington State and Michigan were not showing him enough appreciation. And he said that at one point, he told Vice President Pence, who of course is leading up the coronavirus task force, not to call those governors. He of course said that those governors were contacted anyways by Vice President Pence because That's his style. But I think if you look at that press conference in particular, there was a huge focus on the idea that the president wants to feel appreciated. The subtext, I think, if you look beneath the surface, was if you guys want help from the federal government, if you want to talk to the president about these things, you better not be criticizing the president. But at the same time, we're seeing governors like Gretchen Whitmer in Michigan, basically they are getting the short end of the stick when it comes to federal supplies. And there are some data to suggest, and the Washington Post reported this weekend, that there are disparities between some of these states. So as we move forward, it is going to be a very difficult choice for some of these governors to choose between saying that they're not getting what they want and maybe applying pressure in that way, but also knowing that that could alienate the president and maybe he has an eye out for people who are being too critical of him.
Ashley, what is the president's daily life like right now? How much is he in meetings working on the coronavirus crisis? How much is he watching TV? So many of his tweets do seem to be in response to what he's watching on Fox.
That's a great question. I can answer part of it. He's attending some task force meetings. After a task force meeting, there's often everyone goes up to the Oval Office, a smaller group of whoever is going to go out on stage in the daily news conference, and all of those people and some of their assistants and advisors are there, and that's where they really go around the room and figure out, what is the message we want to hit today, and who are the best people to hit that message? Does it make sense to have Betsy DeVos there if we want to talk about education? Does it make sense to have Steve Mnuchin there if we want to reassure people who have, who have filed for unemployment? There's almost always, or maybe even always, a medical professional there, whether it's the Surgeon General or Dr. Birx or Dr. Fauci, and they kind of huddle with the president. The president he enjoys these briefings. He was the one who pushed to make them. You may notice they started kind of in the afternoon, noon to, they're now all at 5 or 5:30. He wanted it to be prime time. He enjoys that part of it. And then, yes, as always, this is not new, but he is sort of nonstop watching cable news and taking it all in that way.
Ashley Parker, thank you so much. We're going to let you get back to reporting. Thanks for joining us.
Thank you.
Sorry about my technical failings at the beginning here.
Thank you.
You get an A+ for your technical abilities. Erin, what are you watching now as we see two more governors, the governor of Maryland, the governor of Virginia, really tighten the restrictions on their residents, calling for people to truly stay home, right? And defining more clearly what exactly that's going to mean for people there. What are you watching in terms of next steps, in terms of how different states are choosing to approach this?
Yeah, so I think that one of the realities of the situation right now is that it is disproportionately striking metropolitan areas like in New York, like in California. Of course, much of the problem in Florida, for instance, is concentrated around the Miami-Fort Lauderdale area right now. We're seeing, either because of a lack of testing or just because the areas are more spread out, that we aren't seeing this impact some of the more rural parts of our country, the places in the middle of the country, many of which are headed by Republicans. A lot of the hardest hit states are headed by Democratic governors. I think it's going to be interesting to see if once we start seeing cases in some of these less impacted states, if the things can continue on the same trajectory that we've seen elsewhere, or if some of the social distancing and other guidelines that we're seeing from the government are going to be able to kind of tamp down that and maybe flatten the curve a little bit earlier. It's also going to be interesting to watch in the coming days and weeks what the differing levels of federal government support for different states are. This is a competition between many of these states, and the president, as we were just talking about, has suggested that he may not want to hear from certain governors who are critical of him. What happens when there's some real difficult decisions to be made about who gets ventilators? What happens when there is even more competition than there is right now for a very finite amount of resources? Do we see more invocations of the Defense Production Act if it gets to that point? There have been a lot of difficult decisions made already in this crisis, but once the numbers get even bigger, once the resources get stretched even more, those difficult decisions just take off exponentially. And that's where I really think, regardless of what has happened to this point, whether you're a governor, whether you're a president, that's really where the steadiness and the success of a response is going to start to register with people. That's when the situation is really going to get stressful for a whole lot of people involved in the response.
Let's bring William Wan into the conversation, national correspondent covering health and science. So William, Aaron was just talking about the different approaches governors and states are taking. You've been looking at the models and looking at the factors that have to go into us learning about when we might see peaks in different areas, when we might see peaks as a nation. So as you see some governors tightening the ability of their citizens to go around, what can that do to sort of help these models get a better sense of when we might see some peaks, how things might move forward?
They're incredibly important because right now, as you see in New York, they've already put in a lot of restrictions to date, and the numbers are still rising. The rate of rise is slowing, but they're still rising. And so one thing to keep in mind, two things to keep in mind. One being there's a delay when you put in a restriction and when you see the effect, somewhere from 2 to 3 weeks. So Maryland just announced, I got this buzzing on my phone. It's a stay-at-home, complete stay-at-home order. And so 2 weeks from now, you may see the effects of that because it takes, 5 days for symptoms to even appear. Then you have people even getting more serious a few days after that, getting to hospital. Then the deaths are often a much more longer lag after that. So it's great that they're putting these in place. They might have been put in place earlier because of the delay. We would see much better effect now if that had happened. But the other thing to keep in mind is the thing about peaks is if even just a peak on a mountain as you're climbing up it, you don't know you're at the peak often until you're past the peak. And you may think, oh, I think I'm getting close. I'm thinking I'm getting close until you start on the downward trend. You don't really know. And so that's part of the challenge as well with all these models is you don't know until you start to see the slow occurring, the slow of increase. And you won't really know if that's just a slow because of some reporting of cases that slowed down. It's a weekend, there's a blip. It's hard to tell with peaks.
Yeah, the other question about just counting the numbers is tests. I mean, so many people have not gotten tested, even if they have symptoms presenting as the virus. So, William, how does that factor into being able to assess where things are going?
The tests are so important, and I feel like we've been talking about tests for a month now. And the reason is without the tests, it's like you're trying to walk in the dark, blind. You have no information, you have no light on the situation. So New York, they have the most testing of anyone. They have the most numbers. We don't know what's going on necessarily in California or some of these rural areas even where the testing is still kind of slowly ramping up. Once they get the testing, that could be essential to figuring out our strategy going forward.
Aaron, President Trump is looking at the numbers and trying to figure out what to do in terms of equipment allocation. And we're all watching these incredibly moving and just heart-rending videos, first-person videos on the Washington Post website of doctors and people who work in the medical profession talking about what it's like to not have the equipment that they need. What is the White House doing? What is the president saying about this problem with PPE and equipment like ventilators?
Well, in last night's press briefing, the president, for I think the first time, weighed in on some theories about why we're in the situation that we're in with specifically masks and ventilators. He alluded at one point to the idea that perhaps these masks were going, quote, out the back door in these hospitals, like they were either being squandered or they were being stolen or something. There was one point a few weeks ago when Governor Cuomo in New York suggested that there were thefts of masks from certain hospitals, but the president was talking about something on a scale that really would be unthinkable. He basically suggested that it was kind of inexplicable that these hospitals were using 10 to 20,000 masks a week and then suddenly needed 300,000 masks now. There's a very logical answer for that, which is, of course, we are dealing with an epidemic, a pandemic that involves a respiratory disease. So you need to use masks much more than you would over ordinary care. The other thing that he said yesterday was that he accused hospitals in certain areas of the country of, quote, hoarding ventilators, basically suggesting that they had them on hand but weren't turning them over. I think it's logical to think that there may be a reluctance in some areas of the country to send their ventilators to New York, send them to Florida, other hard-hit areas, because they recognize they may be the next ones dealing with a very difficult situation. But I think that if you combine those two things, it becomes evident that the president is minding this storyline, which is that there is not enough equipment out there. And this is also something, by the way, that he's blamed on the Obama administration. He said that the state of the stockpiles was just not good enough. There's not any evidence that he's necessarily done anything to address that in his first 3 years as president. But I think this is going to be one of the big storylines as this progresses. The hospital resources haven't necessarily been stretched in many parts of the country, but there is going to be a real tug of war over these resources once we see other places that aren't currently dealing with issues start to have their own issues, and now they're going to be asking for the same ventilators that New York was asking for and that they got some of.
And we saw Governor Cuomo today in his briefing talk about how hospitals are going to have to help each other out, right? We don't need as many right now, you do, and vice versa. And he points out that a lot of these are private facilities, and so it's sort of a new sharing model that some of them might be engaging in. But are we hearing that same call from the White House, Aaron?
I think the part of the problem with that is that there's going to be overlap between these outbreaks. New York is the situation in New York going to be totally solved by the time we start to see outbreaks elsewhere? I mean, that's not something that you really want to count on if you're one of these other states necessarily. I don't think the White House has been terribly clear about exactly how it wants to address these problems. At the same time, they have held back some of that national stockpile and not sent it directly to New York at this point, perhaps recognizing that those could be used elsewhere in the days and weeks to come.
All right, Aaron Blake, we're going to let you go, and William will stay with us. William, the way you look at a peak and how something rises and falls, we're looking at other countries to see how, for example, China, how long it took for them to sort of hit a peak, and then where there are some regressions, like where there are some problems. So it took China about 2 months from the beginning of its outbreak, and then a month from when they realized how severe this was for them to reach a peak, hopefully the only peak and not just an initial peak. It took South Korea less time than that. What's happening now, though, and what are you watching from those places?
There's some lessons to be learned about what's happening now. You think that right now we're in the thick of it, so it makes sense. We're only thinking about the peak in front of us. But when you look at past pandemics, it's less of one mountain and more of these series of hilly bumps. So like you overcome one and we don't have a vaccine yet, we're going to experience other outbreaks, either coming from out of the country or little hotspots that flare up again. And so you're seeing that in China and South Korea, and even countries like Singapore and Hong Kong were incredibly successful early on, but you're seeing some of those numbers starting to go up again. And so it speaks to this need for a long-term national strategy. Like we are not, right now we're just surviving moment to moment, especially at these hospitals, but you need some kind of strategy, like what Aaron was talking about, for instance, the hoarding of ventilators, of masks. That's natural when you don't have like someone in charge, someone overall assuring. This is kind of how the National Treasury and banks work. Like we all share this common currency. You will get these ventilators when you need them if you put them all. And so in China, one of the really successful things is they just pooled the resources of the entire country and sent in tens of thousands of staff, equipment right into Wuhan, and kind of tamped down that before it could get out of control and spread to other provinces.
I guess the question is, though, have we missed that window here in the United States?
I think the need for a national strategy is so critical right now. At every phase, it's critical. But right now, it's critical because it's becoming clear that the social distancing is not the only tool we need. It's kind of like, one epidemiologist was describing it to me this way. It's like you hand a person a piece of meat and you point them to a fire, like cook it on a fire. And you can do that, but it's so much more effective if you have an oven where you can temper the heat, when you have skillets, when you have other tools. And so right now we're just saying on or off social distancing, But you look at South Korea, what the tools they had were contact tracing. You take one case, trace every person that person has come in contact with and quarantine. Or you look at things like serological tests. These are tests that could tell if you've had the virus and you've recovered and now you have some form of immunity. You could put those people in the front lines at hospitals. They could be the ones driving Uber, delivering groceries. There's like a national mobilization we could be doing, should be doing. Yeah.
We have some questions that have come in on the submission form. And if you're wondering how you can ask a question, we have that form on our Washington Post website. We've also got it in chat on YouTube. You can just see the link right there. Kate wrote in from Monterey, California, William, and asked about the potential for a nationwide lockdown. And she's wondering, what if you had to travel across state lines to care for an elderly relative or an ill relative? Would it be up to the federal government to block your way or the states to block your way? How would you get permission? What do you know?
There's a lot of, there's really real questions about the legality, enforceability, logistical feasibility of something like that. You saw that a little bit when Rhode Island threatened to, I think, enact a lockdown or a ban against New York license plates. And then there was questions about whether that is even like a legally enforceable thing, and B, if it's a good idea. One thing that happened, for example, in China, the initial start of the outbreak, they declared a lockdown for Wuhan starting, I forget, like say Friday, 2 days from now or 1 day from now. You then saw hordes rushing to the train stations, which is the exact opposite thing you would want. If you declared a quarantine against New York, no travel outside New York State, you would see people fleeing, which is exactly what you don't want in an outbreak situation.
So a follow-up from Kate. So what if you had to travel to care for relatives? What's safer? Is it better to go by plane? Is it better to go by car? And Kate points out that even though she lives in California, she has relatives in Alexandria, Virginia, who she's concerned about.
I have to say I'm a little bit out of my expertise there. I haven't specifically reported this question. If it were me, we were kind of thinking through these scenarios a little bit ourselves in our family. And to me, it seems safer in some ways to go by car. You're avoiding high contact points at the airport. You can control all of your travel and your contact outside. You can take precautions. But the thing that's really poignant about these questions is you see kind of people's concerns and how this is playing out. Everyone is kind of having to act as their own mini kind of command center of playing out scenarios. Yeah.
Alicia wrote in and asked about how people without symptoms spread the disease. And this is something, of course, that Kate and the rest of us should all be thinking about, because you may feel fine, you may want to go help care for a relative, but you could actually be a carrier before you even know it as you go about those travels.
That's the really interesting thing about this virus. It's just kind of genius in the way that it works, is that there's a period before you show symptoms when you can be highly contagious to others. When you look at this virus's cousins, like, so she's asked Alicia, which is a great question, is how does this work? When you look at other respiratory diseases, there's often two levers. You can be very, very deadly. That's because that's when it gets in the lungs. Some of these respiratory diseases are very active in the lungs. Or it could be very contagious and not that deadly. That's when it's around your nose and mouth area, coughing, sneezing. So you think of your common colds, that's that type of respiratory virus. For the lung deadly ones, you think of SARS or MERS. The genius about this disease is that it cuts the difference. It is both in the upper system and in the lower system of the lungs. And so it can start out highly contagious without much severe symptoms. And then as it moves into the lungs, it can be really, really deadly. So that's how that happens. There's often like a 5-day window when you don't have any symptoms, but you could be shedding copies of this virus.
You did this great piece that helped me understand better, what a virus is, which seems like something we should all really know about, but this went a lot deeper beyond my rudimentary, knowledge and memory of science classes, and explained how coronavirus is sort of able to get past us and what is, as you kind of call, like this evil genius aspect of it. So can you tell us more about what exactly it is?
Yeah, a coronavirus, it's an RNA viruses. What makes it unique, there's a lot of viruses out there, a lot of RNA viruses too, but even among RNA viruses, it's a little bit unique because it's bigger than the average virus. So this is what a virus is. All it is strands of RNA wrapped up in a little protein shell. And so it's not quite even a cell. It's very basic. It's kind of like guerrilla warfare. It's like one soldier wearing nothing but a knife, just a few little tools, which makes it incredibly efficient. And so this is the way it works, is that it's not a cell on its own. It's not even considered alive by some scientists because it has so little, it carries so little with it. But what it does is, say it gets into your body, the first contact with a cell, some of these tools that it's wearing lets it unlock its way into the cell. And then what it does is it'll take over the cell's whole machinery, all the factory kind of systems that a cell has, and starts using those factory systems to pump out versions of itself. So it's not really quite even alive until it comes in contact with the cell, takes over that cell, and starts manufacturing. One extremely eloquent virologist put it this way to a colleague of mine: it's like a burglar. It breaks into your house, eats all your food, makes 10,000 babies, and leaves with the place absolutely trashed.
So, William, we're seeing something happen in some cases where the person has an onset of symptoms and then seems to improve a little bit and then gets dramatically worse. And what I hear and what I read is that the immune system is really going into overdrive. Can you explain how that happens?
Yeah, and so when we're talking about once it gets into the lungs, that's when it gets really serious. Part of what happens is because this is the reason everyone keeps calling this a novel coronavirus, a new virus, our body has no immunological kind of defense against it. So what happens is the immune system starts sending all of these kind of weapons to fight against this invader. Those weapons end up doing even more damage than the virus itself. In the process of trying to kill the virus, it kills off your own live cells kind of indiscriminately. And then something starts happening later where the immune system it kind of goes haywire and into overdrive. It can't really regulate. Usually the immune system will try to regulate itself to the degree it needs to fight something so it's not overkilling. But what happens with this virus is, especially in old people, it's causing the immune system to kind of go into overdrive and haywire. And so it's kind of like one expert put it this way: it's like calling a misdemeanor for jaywalking, and then the police sends in the SWAT team, and that can often end badly. So that's kind of what's going on with the immune system.
You know, to the question earlier about how people who are asymptomatic can still be passing along the virus or can be carrying the virus, we did see today Congresswoman Nadia Velázquez, Democrat of New York, released a statement saying that she has a presumptive case of coronavirus. She has the symptoms of a mild case of coronavirus, and she says it came on, and I'm reading from her statement, in the wee hours of Sunday morning. She writes, "I began to feel under the weather and I developed the abrupt onset of muscle aches, fever, nasal congestion, and stomach upset." Of course, you know, everyone hopes for the best for her. It's important to point out that she was in the Capitol just, 36 hours earlier, voting with her colleagues and joining with colleagues on Capitol Hill. And so there is this concern of just how the virus could be transmitted from people who may look like they're not sick at all.
Yeah, that's why for these stay-at-home orders are so important, because there's just no way to really know for sure. You could be spreading it and feel perfectly fine one moment and not the next. It's sometimes even some patients have gone the entire kind of cycle without really having any kind of serious symptoms that make them think they have it. That's why the testing is so important. That's why the stay-at-home orders are so important. Yeah.
What are you watching, William, for innovation and for opportunity for companies and individuals to innovate and be able to help supply some of the needed tools right now, either ones that we know are needed, like ventilators and testing kits, or things that we haven't even conceived of yet?
That's we're all looking for kind of sources of hope right now. And that's one that I am reading myself just for fun and for a sense of because this is what America's good at. It's good at finding ways to solve problems. It's good at tapping into a kind of national coming together and can-do-it spirit. And so one of the things that's really cool is these kind of maker clubs that are coming together and trying to tackle ventilators, ways of building very inexpensive kind of DIY things like that. The mask is really, really interesting. There's some agreement among experts that we should all be wearing masks. If you look at pictures and video from Asian countries, for example, contending with this, everybody is wearing a mask when they go out. There's a shortage of masks, and so there's a move now to create, it's not like the N95s, but it's just something that you put over your face. It can be effective in not preventing you from getting it, but if you have it and don't even know it, from spreading it to others. That should be adopted widespread. Like we should be doing that as a country. The other great thing about these kind of DIY movements, I feel like, is there is this reservoir of like people are just stuck at home. They want to be doing something. They could be doing something to contribute. I wish we had better someone calling upon us to do these things and kind of organizing it in a way. And there's a feeling among experts, I think, that there's no way of doing some of the really big things you just can't do without federal government, without national leadership, because of the funding kind of resources and the mandate, just ordering it. But some of these smaller things, it'd be great if some of these movements would start picking up.
We've seen a lot of the saddest stories and clusters of cases coming from nursing homes and nursing home facilities. And one of our readers, Gail, wrote in from Texas and asked if people should get their loved ones out of nursing homes if they could. Of course, that comes with its own set of potential problems and complications, because to do so, you might have to go into the facility. And I just want to point out from our Washington Post Live blog that outbreaks at nursing homes and elder care facilities in both Virginia and Maryland have contributed to the single deadliest day in the outbreak in our region. So, this is something that we saw in Washington State, but we're seeing it in our area, and we're certainly going to see it in other parts of the country, and we already are, William.
That's like a heartbreaking question. I don't have any like direct advice for that, except that I would just say, like, the people doing these kinds of decisions that are really, you see them reading everything they can, making the best decision that they can at that moment. And I just feel like those people you're doing really great work. You're such good relatives. It's really hard decision. It reminds me of times that I have reported on and written about, and kind of like when you look at China, or during the Cultural Revolution, when families had to make kind of life or death decisions in the moment, and you don't know what's going to be right or wrong. Or during the Vietnam War, my wife is from Vietnam, and her mother and father are always telling me about when they fled Vietnam, whether to get on this boat or not, whether to stay in place if that's safer. It feels like that kind of situation where you don't know what the right thing is to do, but you make the best choice you can with the information available to you. And you really can't blame yourself for how it turns out, because we are in this unknown time. We're like living through history right now.
Yeah, there's clarity in retrospect, but in the moment, everyone's just trying to make the best decisions they can. Some people have been asking about renewed outbreaks, right? Let's say an area gets something under control, like New York is able to deal with the virus in the way that they're hoping to, which is to really get everything under control after we, will see continued cases here. What's to prevent second outbreaks or second rounds of this? And I know you've been looking to overseas locations to sort of get a read on that, but what are our health officials and leaders talking about here in the States?
There's actually, in the absence of a national long-term plan right now, there's actually all these experts kind of throwing out their own proposals. And it's been I've been kind of reading through a lot of them, and it's really interesting. There's great ideas in there. And it's so important right now. Like right now we're looking at New York, and it seems like nothing else matters, but it does, because, once the peak comes and passes, that's our opportune time to prepare, because there's going to be other peaks. Like we have to know that there's going to be waves. And so some of the serological tests we were talking about earlier is really important. If you could tell who has it, then you don't have to do this massive lockdown across the state. You can target it to people like those who can say you put this is me making it up on the spot. Say you put a bracelet on people who have passed the serological test and are shown to be immune. They could be out and about society, doing their work, getting the economy going again. It's ideas like that. We need long-term thinking because the peak, there's different estimates. So I won't throw out a specific one here, but like anywhere from like April to May kind of rolling, that the national peak might be somewhere there. If that really is the case, we may have a lull of like a month, 2 months, maybe if it turns out to be a seasonal virus, maybe even a few months together where it's going to be critical. We have to work flat out during those months. We have to prepare the ventilators. We have to prepare healthcare facilities. If you kind of think about after a party, the place is trashed. You need to like get everything together, pick ourselves up, and get ready for the second wave. One very instructive kind of shocking, scary thing that I came across is looking at the 1918 epidemic. They had 3 distinct waves in that. The first passed and people were very relieved and they were like, what kind of happened? When the second hit, it was the deadliest by far. More people died within that wave than any other kind of time during that long pandemic. And so getting ready for the next waves are going to be really important.
Well, William, we really appreciate your time. William Wan, health and science reporter at the Washington Post. Thank you so much for joining us. We'll let you go.
Thanks for having me, Libby.
Yeah, thank you. And we'll say hi to Dave Weigel, Dave, you look like you're somewhere beautiful. I think it's probably home, but I like seeing the outdoors a little bit there. I think your mute is on. Unmute yourself and we'll be able to hear you.
Not.
Yes, you're perfect. In fact, okay. I hear the sweet sounds of Washington, D.C. car alarms and traffic behind you. So we're going to push through that, Dave, because it's okay. Real life. Let me ask you this. You were under like a quarantine in your own home for a while, weren't you? Because you've been out on the road so much reporting.
I haven't been to the office since before I went to Illinois, and that was for the last like normal primary. So that was 2 or 3 weeks ago, I suppose. And I've been in the house. Honestly, I forgot to buy soy sauce. I went to buy some today. So I've not been the ideal citizen. I did have, it turned out, N95 masks because I bought them a couple years ago when covering riots in Baltimore. So I got that going for me. But no, like everybody else, man, I've just been doing all my reporting here.
All right. Well, if you have extra, you can give them to your
everybody else covering politics, I should say. Yeah.
Dave, you write the newsletter, The Trailer, and I love what you did in the issue that came out yesterday. You just answered readers' questions, and your beat is so fascinating right now because the political calendar is continuing to march on, even though the national and international attention is focused on the coronavirus. So I want to go over some of the great questions people asked you. But first, let's start out with the news of today. Joe Biden was just on MSNBC a little while ago. What has Joe Biden been doing till now? Where has he been? Tell us about this presidential candidate.
Well, Biden has just been in his family's house in Wilmington. It's a fairly large compound. It's basically the one big thing he owns. And he has been secluded. People who come to visit him wear masks and wear gloves. Bernie Sanders just went under sort of stay-at-home advisories over the weekend, so he hasn't been out in D.C. too. Both of them, honestly, with the Senate kind of with a gone fishing sign on it for a couple of weeks, you're probably not going to see either of them outside their states until both of them are in places that say, okay, it's safe to travel, and that could be end of April, that could be longer.
Joe Biden critical of President Trump, saying one good thing that he is doing is letting Dr. Fauci speak. So how is Joe Biden talking about and framing coronavirus in terms of responding to President Trump's action or inaction?
Well, he's not responded the way that a lot of people on the left would like him to, which is just a big comprehensive, here's how you remake the entire healthcare system critique. He's defaulted to, here's what worked for the Obama administration in 2009 and 2014. That's the H1N1, the swine flu breakout, and then the Ebola breakout. And Ebola, without pretending that I'm an expert, just someone who's read this as I've covered it, Ebola not as contagious as the flu. So that it's not a one-to-one comparison, but he's been doing that. He's been saying, look, there are big active steps the president can take, and actually calling for more federal action than Trump has done, forcing companies to start making masks and ventilators, things of that nature, things the president hinted at but didn't act on. You can see the contours of the Biden message here, which is that we didn't need to turn the system upside down to fix this. We could, if we had a competent president, we could have prevented a lot of death. That is going to be the message. And if you step back, it's hard to see that maybe from minute to minute, because the candidates are being heard from maybe a couple minutes a day. But that is being amplified by advertising from the pro-Biden super PAC Unite the Country, from Priorities USA, from basically every Democratic group is pretty well aligned on this message. And if you watch enough YouTube pre-roll ads, you see it, which is we could have gotten through this like South Korea. We're not, because of Trump. That's the Biden take.
So Bernie Sanders, still in the race.
He is. I mean, he's actually doing TV tonight. He's doing Seth Meyers. He's not done anything in public since the weekend. He was going to be on cable news, at least on CNN, and was not on the air eventually, which kind of tells you about how presidential candidates are being deprioritized at the moment when people just want information about the virus, about the timeline, about how life's being affected. But he remains in the race. He has not been raising money. Biden has done some donor calls. Obviously, Bernie never did anything of the sort. And Sanders also has recurring donors, about 260,000 people who give a certain amount of money every month. So he have not announced any scale back. In fact, they've announced a greater emphasis on organizing in the primaries that are still to come. But they don't have a lot to say from day to day. And if you read between the lines of stories, you hear kind of the voice of Bernie Sanders himself in some some videos, some interviews, no advertising actually at the moment. And then you hear his staff much less frequently than you did before. They're not getting into any fights with Biden. I think that's the biggest thing that you might miss if you're just online, and everyone's online now, is that there are supporters of Sanders who are from week to week emphasizing something else they think can knock him out of the race. It's the version of this 2 weeks ago was Biden's not visible during the crisis. Version 3 weeks ago was Biden's going to melt down the debate. The Sanders campaign has not swung a single blow at Biden since the March 17th primaries. This is kind of proceeding ahead with nothing that can obviously change momentum, and frankly, nothing that would, except for Biden looking in some way problematic so that Democrats would think he's not the safe bet anymore. But Sanders needs to win about 62, 63% of all the delegates left to win the nomination. The rest of the states left on the map, he lost them last time. Not every single one. I'm saying overall, he got about 47% of them. So something would need to change dramatically.
All right, so let's talk about the state of the race itself. And you just gave us some good insight into the numbers and where things are. But how are states adjusting the primaries? I want to throw one graphic up at you, Dave. This is a new number from the Pew Research Center. 66% of people would feel uncomfortable going to a polling place. So where does that leave us in terms of this primary contest? Well, the first test of that's actually going to be Wisconsin in just 8 days. Wisconsin has an April 7th primary that has not been moved. There could have been moved to a couple days later in the calendar because there's a special congressional election happening in the state in May. They stuck to it. They have a Democratic governor and a Republican legislature who disagree on everything, but they have encouraged absentee voting. Republican absentee voting is a bit higher than Democratic absentee voting, and that's going to be our first test. Before that, you have Hawaii, which is going to do all vote by mail, having replaced a caucus. And vote by mail in states that have a good record of it, like Washington, has been very successful. Turnout's way up. The question is going to really come in, and we're going to get tested this in primary states like New York, but ahead of November. I mean, there are a lot of problems with absentee voting in states that do not have a universal vote by mail system. And I'll give an example of, in Washington, you don't often hear, thousands of votes were tossed out because somebody signed the ballot and it looked a little bit different than the signature they gave the DMV. That's a problem that could be mounted if more states go vote by mail. The problem that in some states there's a Republican opposition to vote by mail because Democrats are for it, because Democrats believe it would increase their turnout. It increases turnout above the board. It just so happens that the states that have done this, replaced all in-person voting with this, Colorado, Washington, Oregon, have had a couple of good years for Democrats. Republicans have won some elections too, though. It's just, but as a matter of social conditioning, if everyone was united, you probably could get people to the point where they're used to sending a mail ballot and filling in everything. And I think that's going to be very lumpy between the states. And the states. And Dave, I just want to point out, we had Aaron Blake on just a little while ago in the hour, and he had a piece today that points out that President Trump said this morning on Fox and Friends that if people were able to vote more easily, vote absentee, vote by mail, it would be bad for Republicans. So that's his take on this too. So there is like a Republican resistance to that.
No, and it's not symmetrical. I mean, Democrats. There are Democratic groups. There's a reason this is part of the Democrats' voting agenda. It's because they think when turnout goes up, they do better. It's not because they think that they are only going to be turning out people who vote for them. They think that there are people who are plugged out of or unplugged from the process who, if it was easy and didn't have to wait in line, would join. And with nobody coming up with a solution for how people don't wait in line if it's an in-person election, you're going to have this conversation. What I'm saying is that if you're Democrats, you're worried about this. In all the Midwestern states that flipped in 2016, there are Democratic governors and Republican legislators, and it's really up to them if they want to cut a deal that they think will maximize turnout by, let's just say, turnout of the people who usually vote in an election. It's not really there right now. Apart from these states that have a lot of experience with it, it is not clear, for example, how Ohio is going to do this. Now, Ohio votes on the 28th of April. I almost said this month, April. They have transitioned to a vote by mail election. Voters have to request their own mail ballot. They've had early voting in the past, but if the turnout in Ohio, which was not a huge high turnout primary state in 16, if that's low, then that'll be a warning sign that more needs to be done.
I mean, this is there even with a vote by mail system, there are still challenges and issues. Like I haven't been able to mail things out for a week or so now. So I've got bills like piling up. So even just the process of mailing isn't necessarily easy. A lot of people don't have access to the tools they would need to even initiate that process if they're stuck at home. I want to ask questions that came over to you in your trailer newsletter. Bob wrote in and asked you this: does the Trump administration have the legal right to postpone an election due to this pandemic?
It doesn't. I mean, we have a very messy system for determining elections, as we learn every 4 years, as we don't fix. Basically, states run elections, but the state is set by Congress. It has been set for 170 years by Congress. And the date of when the president is sworn in is in the Constitution. It can be amended. We amended that 80 years ago, but you cannot move that. This is not. It is much easier in a state that is able to kind of make laws a bit faster. And if you get into the pluses and minuses for each side in delaying it, I mean, Democrats worry about the Trump presidency every single day, want to end as fast as possible. The Trump administration, the president is very confident of re-election, but how many people around him would want it delayed? I guess most people would want it delayed. It's just not going to happen because Congress is not going to agree with the president on this. And I think we have, not in a pandemic situation, but we've conducted elections during wartime. We've elected them in the aftermath of Hurricane Sandy, when people in New York and New Jersey had a very hard time digging out of that, but there was an election anyway. So you can do it. It is actually probably easier to marshal more resources behind making this process kind of as normal as possible than moving the election. I mean, I cannot imagine any single Democrat, and I've talked to some, and not Nancy Pelosi, but none of them agree with that idea.
All right, Rob wrote in and asked, is there any possibility that Andrew Cuomo could emerge as a draft candidate for the Democratic ticket? And I'll expand that out to other governors as well, because we do see America's governors taking a leading role right now in fighting coronavirus. Yeah, so
there's, I think, some good faith and some bad faith in not in the way the question was asked or the person who asked me, but in the way the question comes up. Because in theory, parties always think this, our nominee is okay, but what if we swapped in this dream candidate instead? So I think there's some of that discussion about Cuomo, but the complication comes because Biden is leading Trump in polling. Biden's up by 6 points, and an average. He was up by 6 with all voters, 2 with registered voters. So it's not normally the circumstance. You're talking about, please get rid of the guy. You hear the chatter more from supporters of Bernie Sanders who don't want either Cuomo or Biden to be president, but are I think maybe convinced themselves the idea that there must be some sort of plan because Biden can't keep running the way he's running. And it's strange if you're watching the entire election, because Biden has been running one way the whole time. He's won decisively a lead in these primaries, up 300 delegates. There's never been a week when people said, man, I'm convinced that he will make no gas as the candidate. And I'm not willing to speculate about anything related to the candidate's age, because both he and Sanders are very old. But so,
and let's point out President Trump's age as well, right?
And President Trump's in his 70s. How it would work is that you would need one candidate to withdraw, and then the delegates who have been selected for Joe Biden or for Bernie Sanders, if one of them withdraws, would be free on the at the Democratic convention, or there'd be some delegates who break away. The party actually hardened its delegate rules after 2016, and in a series of compromises. One was that in 2016, because delegates would get actually chosen, the people who go to the convention in some lower turnout county conventions weeks after the primaries and caucuses, Bernie actually picked up people, or he got a slate of delegates who were much more rowdy at the DNC itself. And the parties instead kind of bound those people early to the results of primaries. And remember, the party also doesn't have super delegates voting unless there's a second ballot. So it'd be very technically difficult. But I guess the part underneath all of this is that the party does not need to respect the results of the primary. It doesn't. It usually does, because the alternative is losing the entire election. And there are actually pretty well written rules for what happens if a nominated candidate cannot run anymore, if he must be replaced. We know how that would work. With this, the party, they'd kind of have to make it up going along, but it would start with the delegates being selected. And a reason I explain it that way is because if in this hypothetical scenario, Sanders continued to run but Biden did not, then and it happened, let's say today, Sanders would be in a position to get enough delegates to win the nomination outright without any machination by the party stopping him. But this is the thing. He's losing the nomination without any machinations right now. He's just down in the delegate count because Biden keeps beating him.
So I do have to point out that Scott Clement and Dan Baltz, Scott, director of polling, and Dan Baltz, chief correspondent, have a story from the weekend about how President Trump and Joe Biden are in this very competitive race, and it's gotten tighter. And we're seeing from the poll results that Biden is more trusted to deal with healthcare, but President Trump is more trusted to handle the economy at this point. And they report that when they're asked about who could handle the coronavirus outbreak better, the difference between the two is statistically insignificant.
Oh yeah, sorry, this is going long. I have an interview that's bumping up against this.
All right, we'll let you go, Dave. I think we've ended on a fine place. I think you've given us what you need to give us. So.
All right. Well, thank you.
Appreciate your time.
All right, I appreciate it.
All right, we'll let Dave go. Thank you so much for staying with us for this hour, talking to my Washington Post colleagues, everything from the top news stories of the day. A reminder that President Trump has said that he expects these social distancing measures to continue through the month of April. That's a change from what he had said just a little while ago. We're also seeing the governors of Virginia and Washington call for the residents to shelter in place, and we're learning more about just what details that means for daily life in the Washington region. And we're hearing some pretty stark warnings from people like Dr. Fauci that this could mean 200,000 deaths. So President Trump, echoing the concerns of his health advisors at this point, even as he touts other things like his TV audience and things like that, those health advisors keep trying to bring it back to those concerns about health and wellness and making sure that hospitals have all the equipment that they need. I'm Libby Casey. Thank you so much for watching us. If you'd like to submit questions for the Washington Post to tackle, you can look in chat on YouTube, and there's a submission form link, and also the submission forms on our Washington Post homepage. Take a moment to subscribe. You can do that on YouTube, or of course to Washington Post, to support the work of my journalist colleagues. We thank you so much. Stay healthy and safe.